Hey, everybody, welcome. It's Saturday, June 1st. Saturday, June 1st. I mean, we are in the 6 months of the year, and I wanted to talk about, are you afraid of hormones? And this is specifically for women because men are not afraid of testosterone, obviously. But are women afraid of hormones? And if the answer is yes, that's because society, the medical community, um, studies have put you in this fear for the last 10 to 15 years of your life. And the reality is, you don't need to be afraid of hormones and you don't need to be afraid of taking hormones. So here's the question. Have you ever been with your friends talking about hormones and found that somebody says, "Oh, you shouldn't go on those cause cancer," or "My doctor said that you shouldn't go on hormones after 60," or "My doctor, blah blah blah," whatever it is. Have you ever had or been in a discussion where somebody makes you afraid of either the hormones you're taking or the fact that you are interested in thinking about it? Challenge that I would issue to you first, and I say this all the time, but it's true. Get a copy of my book, The Hormone Balance Bible, on Amazon. It's 512 pages, all about the top 12 hormone imbalances in women. I also talk about how to fix those imbalances, and I talk about the research. Now, the book's only a couple years old, so everything is pretty much up to date still. But I wanted to go through these hormones each and talk about them. The number one hormone that women are afraid of, maybe. No, number one, estradiol. The fear being that estrogen causes cancer. I can't tell you how many times a day I hear this from somebody. Either a patient that I put on estrogen that didn't take it because her friend told her that estrogen causes cancer, or she went to her primary care doctor and they told her that estrogen causes cancer. Listen, all this fear comes from the Women's Health Initiative. And anybody that's listened to me for more than probably 10 minutes and listened to my podcast or videos here knows that the Women's Health Initiative was a complete piece of trash. It scared women out of hormones for 15 years, and it basically ruined an entire generation of women and doctors because the doctors believed the study, which was complete garbage, and they stopped prescribing hormones. So we went from everybody being on hormones to nobody being on hormones, all based on sham crap research that basically was it was just a horrible study. Come out with research since then. There's been multiple studies that have never shown that estrogen caused cancer. And actually, the Women's Health Initiative never showed that. The estrogen only arm of the Women's Health Initiative actually didn't have an increased risk of cancer. And that arm of the study was never shut down. It was the estrogen progesterone arm that had the cancer risk. And it wasn't estradiol and progesterone. It was equilin or Premarin and medroxyprogesterone, which is Provera, which are probably two of the worst medications ever invented by the medical community. So these aren't even really comparable. Recent study, and this is one of the videos that I have here on YouTube, women over 65, a study was just recently done on 10 million women that showed that they had a decreased rate of breast, colon, and lung cancer, decreased rates of dementia, and a 19% decrease in morbidity and mortality, meaning women lived longer. So estrogen actually, to me, seems to be life prolonging. It also allows you to live the life that you want. So I wouldn't be afraid of estrogen. Just because you have a family history of breast cancer does not exclude you from from using hormones. Women that actually have breast cancer might be at a little bit of an increased risk if the cancer cells they have are estrogen receptor positive, because those cells can be stimulated by the addition of estrogen. So that's something you want to keep an eye on. Progesterone. Progesterone is probably one of the safest hormones around. Progesterone really is probably a very beneficial hormone. It's responsible for sleep, anxiety, makes you feel good overall. It balances out the effects of the estrogen. The problem with progesterone is so many women are told by doctors that you don't need progesterone if indeed you've had a hysterectomy. And that's true. You don't need it to prevent uterine cancer, but you might want it to help you sleep, to calm you down, to make you feel more in control, to balance out the effects of the estrogen. Hey, I'm going to go ahead and answer these. So please drop your questions now and I'll answer those later. Testosterone. Testosterone is mostly feared by women falsely because they think if they take testosterone, they're going to get big and huge like Arnold Schwarzenegger. They're going to get acne. They're going to grow hair everywhere. The reason that testosterone is important is it's important for bones and it's important for overall quality of life, muscle density. The more muscle you have, the longer you live. Testosterone is a significantly important hormone. And actually, women have more circulating testosterone in their body than they actually have of estrogen. And this is common throughout life. However, I have noticed over the last 6 years or so that low testosterone is the number one hormonal deficit in women across the board, across all the age groups. Testosterone, number one hormonal deficiency. Remember that because it's exquisitely important and so many women are deficient in testosterone. So where are the fears with testosterone? The fears are if it's too low or if it's too high. Low testosterone feels horrible. You want to take a nap in the afternoons. You decrease motivation, drive, desire, decrease sex drive. You have hair thinning. Also, if your testosterone is too high, like from pellets or injections, you can convert your testosterone into dihydrotestosterone, which is problems in and of itself because that causes male pattern baldness. 23 people here. Welcome, welcome, welcome. Thank you about the book. I really appreciate that. If you're out there and you don't have a copy of the Hormone Balance Bible, it really gives you everything you need to know about all the hormones, and it gives you all of the the answers that you're looking for, and it does it in a way that I hope is easy to read and easy to assimilate. Let's move on to thyroid. Thyroid shouldn't be feared if it's being done, obviously, in an appropriate way, because you can take too much thyroid and that can be a problem because you don't want to be hyperthyroid because then you have heart palpitations and weight loss that's not normal. And you just feel like you drank too much caffeine. So that has risks in and of itself. Thyroid, though, if you're low on your thyroid, you can actually add a little bit of thyroid back to your hormonal regimen. And as long as the thyroid medication is being done in a way that it's not suppressing your thyroid stimulating hormone, then it's not going to take over for your brain, and it's going to just add to the thyroid effects that you have. So it's something you want to keep an eye on. Cortisol is a whole different ball of wax. Cortisol in and of itself is a hard one to differentiate. The whole adrenal fatigue thing is kind of made up by the functional community, but you can have adrenal insufficiency, not adrenal fatigue. That's not an actual thing. However, I don't usually prescribe Cortef or steroids because if a person needs those, they're actually quite sick and they need the help of a good endocrinologist. So don't be afraid of hormones. Don't be afraid of using hormones, and go to a provider. I have women texting me all the time on Instagram at Sean Tassone MD, where they're telling me the regimens that they're on. There's a lot of crazy ass doctors out there that are making shit up as they go, and they're charging tons of money. Remember, the amount of money doesn't always correlate with excellence. There's a lot of people out there, a lot of scam artists, a lot of fake gurus, a lot of false prophets that are promoting themselves as hormonal experts that really have absolutely no training. They went to the same guy, Neil Rosier, who basically tells everybody to overdose patients, and it's not appropriate. So keep in mind that you need to find a good provider. Not afraid per se, but I'm having a hysterectomy next month, which my doctor wants me to stop taking my micronized progesterone. Is it contraindicated? No, it's not contraindicated. I just answered that a few minutes ago. Doctors will tell you that you can stop the progesterone after the hysterectomy because you don't need the progesterone to protect your uterus against uterine cancer. However, if it's helping you sleep, if it's help calming you down, if it's help balancing out the effects of the estrogen, then if you stop taking it, you're not going to feel particularly good. So these doctors obviously aren't super knowledgeable in the effects of the hormones. They're looking mainly at the uterine effects. I'm happily using the compounded hormones and the progesterone tablet now, and a script warns of stroke, cancer. When will they stop? So they're going to keep that in there because they are quoting, again, the aspects of the Women's Health Initiative that showed that. Now, oral estrogen can increase the risks of blood clots and stroke and heart disease and things like that. It can do that. Topical doesn't have the same risk, but they're not going to change the insert because that's probably going to be something that's there forever. They're kind of stuck in a way because they're using this. What they're saying is that the equilin or the Premarin is the same thing as estradiol. It's not. It's completely different. Doesn't even remotely look the same under a microscope. However, they're never going to do a study on plain old estradiol because there's really no money to be made in it. And so they have to use the inserts from the other medications because they don't have any of their own. Questions. My estradiol was 149, not on hormones, 53. Said it must be granulosa cell tumor. No, it could be a granulosa cell tumor, but I can tell you in the 25 years that I've been a doctor in GYN, I've seen one. The fact that you have elevated estradiol could possibly be because you're not in full-blown menopause yet and your body's just making its own. That's a totally normal estrogen level for a woman that is ovulating. So again, maybe you're just not in, menopause. I can't really answer medical questions for you because I don't know you. If you want to get a second opinion, feel free to call me, 512-956-0296. When I had over 20 hot flashes on a Texas hot summer day at 51, I said, that's it. It's debilitating. I'm 66 now and glad I took charge. Yes, you have to be your best advocate. You have to be the one who goes out there and gets the things that you need and that you want, because nobody's going to do that for you. And the book that I'm working on right now is all about advocacy and how to talk to your doctors. I'm sorry for this background noise. I'm trying to talk loud over it. But anyways, my point is that again, you have to be your best advocate and you have to know. That's why I make these videos, is you have to know what questions to ask your doctor and how to do things. So I like to keep these videos kind of short so people can listen to them in the car, maybe check them out and not have to sit here for a half an hour. So I'm going to kind of end there. But I just wanted you to know it's okay to be afraid of hormones, but I'm trying to debunk any of the things that come out. I want you to have a great weekend. I want you to be your own best advocate. I hope that you're all having a great weekend. Remember, Confessions of a Male Gynecologist is my podcast. I talk a lot on there about the hormones a little more in depth of each one. I also have the book, The Hormone Balance Bible. It's available on Amazon. I'd love for you to get a copy of it so you can kind of have that just in your ready so you can answer questions and ask the right questions. Have a great weekend.